Happy Wednesday. We're here at New Teeth Chicago Dental. We always talk about implants, missing teeth, all on four, full top and bottom, and a lot of replacement of missing teeth. So today we're going to showcase a patient of having veneers. I mean, veneers are porcelain replacement. They're not a replacement, but they're to enhance the appearance of your front teeth, front 6, 8, 10, however the patient needs. There's no magic formula that you need 2, 3, 4, 6. Whatever the patient needs is what we do. Typically 6, 8, 10 veneers are pretty typical for patients for front 6 to 8 teeth, for an ideal solution for if they have gaps, if they have missing teeth, not missing teeth, if they have gaps, if they have old porcelain work, and just not happy with the appearance. So veneers can literally make a smile look radiant. And we'll show you a case of a before and after, and the patient that just had the veneers done. So if you look at the situation before, we have an old crown that's had porcelain and some dark metal showing, a space, and teeth that we can make them look a lot nicer and better and even. So the patient sat down with me for consultation. So I said, I recommended 6 to 8 veneers. And so we end up doing 6. We did 1, 2, 3, 4, 5, 6. This one was replaced with a crown. And you'll see what the patient looked like now when we're done with the veneers. It looks absolutely incredible. So we went from here to a beautiful set of 1, 2, 3, 4, 5, 6 porcelain teeth. This is a full crown, but this is a veneer, this is a veneer, this is a veneer, this is a veneer, and this is a veneer, and this is the full crown. So here, we're not even going to discuss implants. We're just going to talk about cosmetic enhancement of your smile by placing veneers or possibly crown. If the old crown needs to be replaced, literally takes 2 visits from here to here, and we can customize your smile for you. And I have my patient right here, and she's absolutely a wonderful patient, a very beautiful person inside out, and she's very, very happy with the results. So from here, and when we're over here, Miss Scott, smile for us. Great. So how did the veneer process overall go for you?
Oh, it went well. It went very well, but I was, of course, skeptical and
Sure, of course.
scared. But you guys really assured me that everything was going to be all right, and so
Right.
it was all right, and it looks very good. I didn't know I looked that nice.
Right.
I didn't know I looked that nice. Everybody had been telling me that, and so you do a very good job with veneers as well as doing the implants. I see. Oh my goodness. I mean, this is really real. For real, it's real. Like, I never think that you would have did such an amazing job.
I really appreciate
not
that.
to doubt you or nothing, but I was just kind of scared, and I didn't
Of
think
course.
that I could look like
Of course.
your real patients.
Right.
So,
I mean, it's hard to know, like, how am I going to look like from here, right, to going from here to here, and make it look very nice and natural. That fits you,
yes,
right?
yes.
Not somebody we did last month, not somebody we're gonna
Yeah.
do next
Yeah.
week, right?
So that's really true that you do the things personally for each person, and you personalize it to their smile and to their personality. You did a very good job.
Well,
with that.
thank you so much. Thank you so much for saying that. We really mean that. And that there's a lot of patients that want to know what they can do just to enhance the appearance.
You didn't throw somebody else on me. You made me.
I took care of you. I took who you are, and I appreciate your input. Thank you so much. You're done. Now we're just going to make your finalize your implants in the bottom and smile again for us. Congratulations. You look amazing. Thank you for sharing. I appreciate it. Thank you.